Hello, everyone, and welcome to our weekly Living Well series. I'm Tara Parker Pope, founding editor of Well, the Times Consumer Health section. Today, I'm so excited to be joined by Professor Linsey Marr, one of the world's leading experts on airborne transmission of viruses. She's a professor of civil and environmental engineering at Virginia Tech. Linsey, welcome.
Thank you so much. I'm excited to be here.
I'm really glad you're here too, and I think our listeners are also. Hello to everyone listening. We want to hear from all of you. So you can submit your questions at any time during the event using the Q&A feature in Zoom. And tell us where you're writing from. Please note that this event is not a substitute for professional medical advice, diagnosis, or treatment. Please reach out to a professional health provider with any questions you might have regarding a medical condition. This event is also being recorded. So let's get started. Send us your questions. I'm going to start chatting with Dr. Marr for a few minutes. We have a little video we want to show you that I think you guys will learn a lot from and be interested in, and then we're going to start taking your questions as soon as possible. So start sending those questions. So Dr. Marr, thanks. It's been great talking to you over these past weeks. I've learned so much, and your work has informed so much of what we've reported in the New York Times, and I think a lot of national media. I know you get a lot of phone calls from the press, don't you?
Oh, usually 5 to 10 at least per day.
That's crazy. That is a lot. And it just shows how, we're just all looking for information and trying to make good choices. Tell me a little bit. I really like the story of how you became interested in aerosol science. So you had been studying air pollution, right?
I've been studying traditional air pollution problems like vehicle emissions and ozone formation. We got a little bit into engineered nanoparticles and potential health and environmental impacts.
And then what happened that shifted your focus more to infectious disease?
And then we had a baby, which changes everyone's lives. And, he started daycare, and, I think they get an average of 25 infections per year. And so we'd get the phone call every week or two, your son is sick, you have to come pick him up. That means he can't go back the next day either. So of course it's very disruptive for work from a selfish standpoint. But even more intriguing was that when I'd go to pick him up, I'd find out that half the kids were sick at the same time. And I know the daycare was practicing very good hygiene. We had to wash our hands when we came in. They made the kids wash their hands all the time. Anything that they kind of touched too much or went into their mouths, they put it into a disinfection bucket. The place was very clean. And so with it spreading so quickly and so easily, I was thinking, well, how, is this maybe going through the air? And especially with the little kids who aren't mobile. And so I started reading about it to find out, okay, how much is going through the air. And then I found out that we don't know, even for flu, and people have spent decades trying to figure this out, how much transmission is occurring through people directly touching each other, or maybe touching a contaminated object, or potentially through the air. And then reading about kind of the different routes of transmission, I also realized there was maybe a misunderstanding about how the smallest droplets, or what we call aerosols, behave.
So fast forward to now, where we have a pandemic of a respiratory illness, and your work suddenly has become just really very important. But there is still this debate, it seems. Should we wear a mask? What does the World Health Organization say about, is this an airborne virus? Why are we still talking about this? I mean, it feels like this is an airborne virus, but I guess there's a distinction between a virus like this versus maybe measles or tuberculosis. Can you explain that to us a little bit?
Yeah, some of it comes down to different ways that different stakeholders, I guess, define airborne. So in some circles, airborne means it is transmitted by droplets, microscopic droplets or aerosols smaller than a certain size at long distance. For, kind of the lay public, and which was me coming into this field, I think of air and I think of something traveling through the air. It doesn't matter how far away I am. It's something I could breathe in potentially. So there's a distinction between what they call large droplet spray transmission, where if I'm close enough to you and I'm talking or I cough on your face and my large droplets kind of fly through the air, follow this trajectory and just land right in your eyes or right in your nostrils or right in your mouth. But at the same time, I'm also releasing hundreds of times more microscopic droplets, which we like to call aerosols, smaller than 5 or 10 microns, So there's going to be this dense cloud of those. You could breathe those in, and they can also remain floating around in the air and then kind of spread out in the room and potentially build up in the room so that other people could be exposed. So I think and then there's a misunderstanding about this size cutoff that the World Health Organization and other agencies use. They talk about this 5 or 10 micron distinction, but in fact, on basic physics, we know that a droplet of that size can actually stay in the air for half an hour, or maybe at the 10 micron size, we're talking about 8 minutes. So to me, I don't think of that as something that's falling out immediately on the ground. 8 minutes to 30 minutes. I think that's time for it to move around a bit in the air.
So when you talk about that potential of something floating around in these clouds, though, I mean, how concerned I think there's a general fear that when we step outside, we're walking into a viral plume, or when we walk into a room, we're walking into a plume. Like, how do we kind of gauge our level of fear, of knowledge? What are we supposed to think about? Is the world just like, are we just walking into a swarm of virus every time we leave the house?
No, the air is, atmosphere is even bigger in volume than the ocean, maybe, I think. So we're talking about lots of dilution that can happen. So the, things that come out of your mouth, yes, close to your mouth, they may be very concentrated, but as soon as you get farther away, they become much more dilute, and the chances of someone else breathing those in become lower, unless of course you're very close to the person, or if you're in maybe a small room or a room with lots of people and poor ventilation, where the levels of the virus can build up. So I like to think of it as smoking. So do I want to be, indoors with a smoker or outdoors with a smoker? Well, I obviously would prefer to be outdoors because there's going to be a lot more dilution. Well, do I want to be in a room with 10 smokers or 1 smoker? Okay, I'm going to try to stay away from the 10 smokers. Does the smoke really build up in that room, indicating that there's poor ventilation, and potential for virus to build up too? So there's all these different factors that affect it. So, I don't walk around constantly afraid of running into virus or being exposed to virus by breathing it, unless I'm in, a crowded situation or I'm close to people and it's poorly ventilated.
Okay, that's helpful. So one of the things I learned from you is that when somebody sneezes or coughs, say, let's assume they're ill, that they have a COVID or a flu, just because those droplets go out into the air, every droplet isn't necessarily infectious or doesn't necessarily have a virus in it. Is that right?
That's right. I mean, it can depend on the person of how much virus they carry. I think we've seen with COVID-19, people can carry anywhere. It can vary by a factor of 1 billion, actually. Some people have 1 billion times more virus in their respiratory fluid than others. So that's one factor. And then, if you cough, let's say that's tens of thousands of droplets. Maybe there's only a few hundred viruses. So not every droplet contains a virus. That's one of the questions people are still looking at is, how many viruses are in any one droplet? Are they all clumped together, or they're kind of spread out more? And what size droplets do the viruses tend to congregate in, or are they kind of evenly distributed over all the volume of respiratory fluid that comes out?
See, I think a lot of people think that if I come into close contact with you and if you have COVID-19, that I'm definitely going to get sick. But I think what I've learned through this process is that a couple things have to be happening for me to actually get sick. Can you talk a little bit about that?
Yeah, so if you're in close contact with someone, you would need, that person needs to be releasing large amounts of virus in their respiratory fluid. Most people don't release that many droplets when they breathe, but talking and coughing, singing can certainly release more. It would have to be kind of for an extended period of time for you to have enough of a chance to inhale those. Even if you're close to that person, and let's say they release this plume of droplets, only maybe 2%, 1 or 2% of those will actually come into contact with your body, like land in your eyes, or maybe that you'll inhale. And so of those maybe 2%, they would have to contain the virus. That virus would have to be infectious. And then furthermore, we think it takes kind of more than just one to make you ill. So it would have to be, kind of extended face-to-face conversation with someone who's infected, which is quite possible without them having any symptoms. and releasing lots of virus.
And extended, how much time is that?
Oh, there's no sharp cutoff. You know,
No.
the shorter the better for you. But we think, you know, I've heard numbers anywhere from kind of 10 minutes, half an hour, an hour kind of thing.
I know with contact tracing, if I have the virus, they want to know who I've spent 15 minutes or more in close contact. Is that the contact tracing cutoff? I think it is.
I haven't followed that discussion.
I think it is. I'm not sure, but again, it's kind of just a guess. They don't really know because we don't know about this virus yet. So I wanted, there's a video that your graduate student?
One of my former PhD students, who is now a professor at the University of Colorado, Marina Vance. So her name is Marina Vance. She's a professor of mechanical engineering.
And so the two of you collaborated on a video that I thought was just a really useful primer on virus. So we're going to share this with you guys and take a look. It's just 2 minutes.
When we breathe, talk, laugh, cough, or sneeze, we release droplets into the air. Some of these are microscopic and can remain floating in the air for an hour or more. Others are large, fly through the air briefly, and fall to the ground or other surfaces within seconds. If a person is infected with the virus, some of the droplets may contain viruses. The droplets also contain large amounts of salts and proteins and other chemicals that are in respiratory fluid. If the air is not very humid, some or all of the water in the droplet will evaporate, leaving behind a smaller droplet that is about half the original size. From research on flu patients, we know that at least half of the viruses that are expelled into airborne droplets are found in those smaller than 5 microns, which can remain floating in air for half an hour or more. During this period, they may be carried by air currents many meters from the person who released them, but this process also dilutes them in the air, reducing the chance that you could breathe in a lot of them. Viruses in droplets that land on surfaces and in the microscopic ones that float in air break down over time and lose their ability to cause infections. How fast this happens depends on the type of virus and conditions such as temperature, humidity, and the type of surface material, whether it's cloth, paper, plastic, or metal. There are a lot of things we still don't know about viruses in the air. We don't know how much transmission occurs through inhalation of such viruses versus them landing in our eyes, nostrils, or mouth versus touching them on objects. For most types of viruses, we don't know how many are found in different size droplets and how well the viruses survive under different conditions in the real world. What is clear is that for some types of respiratory viruses, transmission at close range can occur through multiple routes, including direct spray of large droplets onto the body and inhalation of microscopic droplets.
So one of the things you mentioned in there is the role of humidity. And I know this is a big part of your research. You've done a study on the role of humidity with flu. Can you tell me just quickly about that? Because I have a common question on this issue. So tell me about the research, what we know about humidity.
Yeah, there's a large body of research indicating that many types of viruses survive well under fairly dry conditions. So if the humidity is below about 40 to 50%, which is very common in the wintertime in temperate regions where we heat the air. And they don't survive as well kind of at these mid-range humidities between, let's say, 45-ish and maybe 70, 80%. And then they survive well again at very high humidities. And you know, we've suggest that this might help account for seasonality of certain respiratory infections, including the flu and colds. But there are many other factors, of course, that affect transmission and incidence of these diseases. And you know, it's a bit of a mystery because we also did this more recently with a collaborator, Seema Lakdawala at the University of Pittsburgh, where we actually put the viruses into more realistic fluid, like with some of the secretions, mucus that comes from bronchial cells in the respiratory system. And in that case, we actually found that the viruses survived in aerosols very well over all humidity conditions. So I'm still scratching my head about that one, whether there is a humidity effect or not. We do know, I guess what we do know is that when you do these types of experiments, you have to be very careful about the type of liquid that you're using, because that has a big effect. And I think there are situations when we know there are situations when humidity affects things. And certainly with the coronaviruses, they seem to survive better under low humidity conditions and extremely high.
A lot of readers have asked if they should have I guess there's dehumidifiers, machines you can put in your home to affect the humidity level in your home. Is it worth trying that, or what's the thought behind what we can do in our own homes and the air in our homes?
Well, in terms of this, of SARS coronavirus 2, I think all bets are off because it's a new virus. So the seasonality that we've seen for other viruses is for ones that have been circulating for a long time. And we know that when they are first introduced, we don't see that seasonality. That said, I think there's other benefits to humidifying the air in the wintertime, just for skin and respiratory health. It's shown that your immune system might be affected by that too. So, I think it certainly probably wouldn't hurt if you humidify during the winter time, but you don't want to go above about 65% because that can promote mold growth. And then of course, there's trade-offs in terms of energy, and maybe there are some other pathogens that do survive well in these mid-range humidities. So it's one of those questions where there's kind of these tantalizing hints, but we don't know enough to make any particular recommendation. But certainly if you use a humidifier in the wintertime for comfort, that that might also have some effect on virus survival. But
right.
in your house, hopefully nobody's infected. So
right. All right, let's get to some questions. We've got a lot. Eugene asks, what is the risk of airborne transmission if you sit in an enclosed office that shares the air with other offices in a building where you can't open the windows? This sounds like all of New York. You can't open the windows. What are your thoughts?
I think it really depends on the ventilation of that building, of how much fresh air is brought in, through the ventilation system if you can't open the windows. There was a study showing an outbreak in a call center in Korea, I believe, where it was just kind of on one side of the office building, and I imagine there was poor ventilation in that section. So anything that building managers can do to increase ventilation with fresh outdoor air, not just recirculated air, should help.
That study was interesting because there were a few hundred people on the floor, and about 95 or so, and they were almost all on the same side of the call center, got sick, but not really people traveling between floors. Other floors didn't get sick, even though some people were moving up and down. There was a couple cases, but the spreading event was really concentrated in the office, which I guess makes me feel, it doesn't make me feel anything. It sounds terrible, but it's not really from the elevators. It's not really traveling up and down floors. It doesn't sound like. It sounds like concentrated time in one space.
Right. Spending extended time there. I think if you spent all day in the elevator riding up and down with lots of different people, you might see the same thing.
Right. This is actually a really common question, and you and I have talked about this before. Bob asks, can the virus particles hitch a ride easier on other particulates in the air like cigarette smoke or pollens?
Yeah, that's a good question. So when the viruses come out in these droplets, if the droplets dry out, then you have this other solid material left behind, like the salts and the proteins, and they're not likely to bump into other particles, to hitch a ride on other particles in air, because for that to happen, for the particles to bump into each other and kind of become one, you have to have very high concentrations, numbers of particles, levels that we typically would see only maybe in a vehicle exhaust plume or an extremely polluted summer day when you have a very intense air pollution event. And as for smoking, that's one several people have asked me, and I've thought about that a bit. And I think that if you're a smoker and you're exhaling smoke particles, the virus would have to become aerosolized anyway within your respiratory tract, kind of move from the liquid lining the tract into the airspace anyway. So it's going to come out anyway. I'm not sure that the cigarette smoke itself is going to kind of pull any more virus out of your body than would be coming out anyway.
So a person who is infected and is a smoker, the act of smoking, drawing the smoke in and exhaling the smoke, that's not, in your mind, that doesn't sound like an event that would necessarily push more particles into the space than if they were just standing there breathing?
Yeah, I guess if they breathe differently when they're smoking, if they inhale and exhale more forcefully, that can lead to more aerosolization of particles, or if somehow the smoke affects the chemistry of the respiratory fluid, and then that could potentially lead to changes in its surface tension and the formation of droplets during the breathing process. But I'm not aware of any studies on that.
But I would think the advice would be the same, right? Keep your distance, wear a mask.
Right. So, they're smoking, you want to stay away from their cigarette smoke, stay away from any virus they might be releasing too.
I don't actually understand this question, but maybe it's just a really smart question, and that's why I don't understand it. Hallie asks, what role do aerosol surfaces play in airborne virus transmission? How does surface tension affect virus survivability and integrity in droplets? So maybe you can explain the question and then you can answer it.
Yeah, so I think what she's asking, or what they're asking is, like, how does the chemistry of the aerosol, so you think you might have this wet droplet and it could have, the surface tension can be, maybe it's close to that of water, or maybe it's actually a little bit lower because we have surfactants in our respiratory fluid, especially down in the lungs, to help keep the airways from sticking together. That's a good question. That's something we don't know, that my group is really trying to better understand, of kind of how does the chemical composition, including surfactants and surface tension, affect inactivation or decay of viruses. And we also don't even know where exactly in the droplets the viruses are, whether they're kind of a virus might be evenly distributed in the middle of the droplet, or maybe if it kind of tends to, is attracted more to the interface or the surface of the droplet. That's something we spent 2 years trying to figure out with different microscopy methods, and didn't get very far, unfortunately.
What are some of the tools that you use to do your research? I mean, we're talking about something invisible, in the air, things we can't see. So what would be like the tools of your trade?
Well, to detect these aerosols or microscopic droplets, right, you can't see them. So there's a few different ways of measuring them. They involve different equipment that costs thousands of dollars to hundreds of thousands of dollars. One of the ways is the simplest way is by light scattering. So you go into a store and they have one of those like laser beams across the doorway, and it dings when you cross it. Well, a particle passing through a laser also kind of, not that it blocks the light, but it kind of scatters the light or redirects it. And so that's one way of detecting particles. For the very smallest ones, though, that doesn't work. They're too small to scatter light. And so what we have to do is we have to kind of grow them to a large enough size by condensing water or other liquids on them. And then we can detect them using these other methods that work for larger particles. And then there's also ways of detecting their size by figuring out kind of how fast they travel in an airstream, and how much drag they have. And then, for us with the virus studies, we use something like a medical nebulizer, or almost like, think of it as a fancy spray bottle to spray viruses into a chamber, which is actually basically a rotating drum where we can keep the viruses and droplets suspended in air for a while. We expose them to different humidities, and then at the end we can pull them out and see how many are still infectious.
It's fascinating work, and thank goodness you're doing it. So more questions. Janine asks, what can you do to improve ventilation? Air conditioning, keep windows open, fans. Let's imagine we're in an office or an enclosed space, or maybe we're going to somebody's home. And what would be the precautions you would take to improve ventilation?
Certainly opening windows and doors that you can. If you can, the problem with the ventilation system is we often don't know if it's bringing in fresh outdoor air or if it's recirculating air. So if and can control that, bring in more outdoor air. Another way, even if you can't control those things, is to get some kind of air purifier that removes particles, because that will also remove these droplets, dried out or not, and any viruses in the air, at least close to that unit. So these are, I would definitely look for something that's HEPA, high efficiency particulate air, can remove particles very efficiently. But, keep in mind that the placement of that is important, and what its flow rate is, the bigger, the better.
So is that something, when we're talking to, small businesses or big businesses and going back to work, Do they have indoor, these indoor air filters? Are they bringing in fresh air? Like, are these the questions to ask about how they're managing the air in our office?
Yes, definitely, about kind of what is the kind of, they'll talk sometimes about the number of air changes per hour. So if it's one air change per hour, the idea is that the entire volume of the air in your room or office is kind of changed out once per hour. You want that number to be as high as possible. Maybe in hospitals, they have about 12 air changes per hour in some of their patient rooms. And so that means that the air is only it stays in there for an average of 5 minutes. Anything about filters that they use in their HVAC system, you want it to be as high they call it a MERV number as possible. Although there's some trade-offs there with some systems can only handle up to a certain amount. You want to make sure those are changed at the recommended frequency, and that they're running with as much fresh outdoor air as possible.
Okay, that's helpful. Okay, some questions about masks. Rachel asked, when outside, if we keep 6 feet of distance, do we have to wear a mask?
It's not a hard and fast rule. It depends on, for me, it would depend on how many people am I passing by. If it's a continuous stream of people at 6 foot distance, then I think, oh, each one of those people passing by is a small amount of chance for exposure. And so if that adds up, let's say I pass by 1,000 people, like, am I okay with that? So I think it really depends on how frequently you're passing by people.
All right. Margot asked, I'm overwhelmed by the options for mask, disposable, cloth, filtered, etc. How do we know what mask works best? And I know you're doing some work on this right now.
We are. Boy, there's so much out there right now, so many new ones coming out there. I think that we don't know. One of the key things to look for is a good fit, a tight fit. So you should feel some resistance, breathing through it when it's on. If you don't feel any resistance, then it's probably not working well, or you have big gaps. You want to make sure there's no big gaps, because that would just lead to short circuiting where particles come in through the side or leak out through the side. I think I've read that more layers is better, but there's also the breathability issue. There's a trade-off there. So kind of as many layers and different materials are supposedly better than the same material, multiple layers of the same material. So that's a tough one, and another suggestion is to kind of hold it up to the light, make sure you don't see little pinpricks of light through it, because those are big holes, of course. We're in the process of testing just common materials using the CDC recommended mask designs, homemade mask designs. We're testing some bandanas and other things, but it's going to be several more weeks until we have some results. But there have been a couple of studies out there recently looking at different types of materials, and kind of, dense weave, multiple layers, good fit I think are key.
And to the listeners, the Times, we've got something called a user's guide to face mask that has a lot of links to that research. So that's a place to start, the user's guide to face mask. Just Google it, and that probably will answer a lot of your questions. Another listener asked, given that some restaurants are opening for outdoor dining, how much does it increase risk to sit at a table and eat with someone, as opposed to just sitting and talking with or without a mask at a table? So I guess the question is whether there's more risk from eating and sharing food versus just a conversation.
It depends on how much talking you're doing, and I think at this point I would avoid sharing food with people. I think otherwise it's probably not that different. The talking versus eating. If it's someone who's not within my household that I'm having a meal with, I would try to sit as far apart as possible at the kind of opposite ends of the table with them, and also make sure that our table is far away from other people's tables.
And probably not sharing dishes. Don't share dishes.
Right. So when I was saying not sharing food, not sharing dishes or anything else, because there's just more potential. It's easy to do, and then you can cut down on any potential for transfer on the hands.
I get a lot of questions on this topic, and I think people assume that the people they're dining with are safe and that they have to worry about the people, 6 feet away from them. But I always ask, well, who are you dining with? Because that's the people who are within a few feet of you. Just because they're your friends doesn't mean they're not a risk, right? I mean, they're not in your household. They're kind of like the stranger down the street, right?
Yeah, absolutely. Unless you know that they have also been very, very careful. And, otherwise you're potentially exposing yourself to them and everyone that they've been exposed to recently. And that's why I'm saying, if they're not in your own household, that you should still sit far apart. Because we've talked about, people have talked about asymptomatic or pre-symptomatic transmission. Someone can have no symptoms and still be shedding a lot of virus.
All right, let's talk about schools. This is such a big topic and a difficult topic. Gina asked, how does airflow in a classroom affect virus spread? Can schools reopen without proper ventilation? Should schools only be open for 2 to 3 hours a day? So you just want to give us your thoughts about how schools can manage this and what maybe parents can ask about what their school is doing?
Yeah, I would ask about the ventilation in the rooms, as we've discussed here before. I think a combination of good ventilation in the rooms, distancing where you're trying to keep, where the desks are at least 6 feet apart, and everyone wearing masks, I would feel comfortable sending my kids into that, assuming that they're, of course, following other precautions regarding, people who are sick don't come in. They're minimizing mixing between classes. They have kind of they're addressing many other issues. But I think if my kid were sitting in a class, I would be okay with that if there's enough ventilation and, again, distancing and masks. But the things to ask about are kind of what is their policy on well, what do they know about the ventilation in the room, and how much is kind of fresh outdoor air versus just recirculated air within that classroom or with other classrooms, because you certainly don't want to mix it between different classrooms. That's just more mixing, and you don't want that. And then, I think there's growing evidence that masks make a difference. And so if everyone's wearing masks, then I think that's just another kind of thing that we can do, another strategy that if we layer, no one of these strategies is 100% perfect, but if we kind of layer these strategies on top of each other and combine them, I think we can achieve a large reduction in risk of transmission.
So we talked about a classroom setting where you've got the kids at desk and the windows are open and you've got air circulating. Another listener asked, how can we lower the risk of infection for students who want to participate in group activities? Let's start with sports. Thoughts about that? I know the CDC has some guidelines about sports. They don't mind, they recommend sort of skill, like drill and skill practices versus contact and team play.
Right. I think if you're practicing in a way that keeps people apart, if you're outdoors is better than indoors, of course. And if you are indoors, limiting the time and, again, making sure it's a large, well-ventilated room, then I think it's okay. I think there's a lot of benefits to be gained from kids playing sports and being active.
So say a middle school basketball team. So they're in a gym. It's a pretty big volume of space. Are they wearing masks while they practice?
Ideally, but I think that's hard to do when you're exercising and breathing hard. If it's a small group, so 5 people on a team, let's say they have 10 players on the team and they are practicing good, maintaining their distance and otherwise, outside of the basketball team, I guess you could consider it a family group, and, try to keep them isolated within themselves, and, have the doors to the gym open, and do more individual skills drills, or we need more passing. Of course, you can't avoid physical contact in basketball, but I think in a lot of situations I'd be okay with that.
All right. Another question that's coming up a lot, and I know you've looked into this. A lot of people are asking about singing, choir, playing instruments, wind and brass players, school bands, school orchestra, school choir. That's a little bit different, right?
Yeah, singing is more like coughing than it's like talking in terms of the droplets that are released. And, in a one-on-one conversation with someone, I'm taking turns talking with the other person, so we're not both talking at the same time. But if you have a choir and you have 20 or 30 people singing all together, so imagine you've got 20 or 30 people all coughing in a room together. That to me is I would be concerned about that type of situation. I think you could do it outdoors if people are spaced apart. As far as the band instruments, I think we don't know enough yet, but at this point, I'm erring on the side of caution. I know that Shelley Miller at the University of Colorado is undertaking a study of woodwind and brass instruments and what's being released, although it'll be several months before those results are available. But I guess for instruments, again, I would say, outdoors, distanced, I think would be the safest way to do it. I certainly wouldn't want to participate or endorse those activities indoors.
Right. All right. Let's move on quickly to travel. A listener asked, what are the risks of a 12-hour flight? In particular, how safe is the airplane bathroom? That's a big question we get a lot. So let's first talk about the airplane itself, and then you can talk about the restroom.
Yeah, so there was an outbreak of the original SARS on an airplane where I think 20 out of 120 people ended up getting infected. It's not clear whether the ventilation system on that airplane was working. So this was in 2002 or 2003. And the transmission was attributed partly to airborne transmission with aerosols, even traveling longer distance perhaps, and the kind of large droplets, and also by contaminated objects. But typically when we see infectious disease transmission of respiratory viruses on airplanes, it's usually within a few rows of the infected person. And I think the airlines have gotten better about having more HEPA, the kind of high efficiency particulate air filters on planes, although I'm not quite sure about the regional jets. And, given what I know about the ventilation systems on airplanes, if it's not totally full and if everyone is wearing masks, I would be more comfortable than a full plane and people not wearing masks. 12 hours is a long time, of course, but unfortunately, we can't put numbers on these risks. There's just so many unknowns about the long flights. So, I think it comes down to your own personal risk tolerance and your own health situation and why are you traveling. The bathroom, boy, there's a small confined space. I don't know about the ventilation in bathrooms. Some of them I've seen the little air vents. I would certainly turn those on, and maybe there should be a waiting period between, wait before you go in there after someone else has used it.
That would make sense. What about now the flush is different on an airplane toilet than a bath, in your apartment or your home. It's got this kind of vacuum that sucks it down. Closing the lid, what would you?
Yeah, definitely close the lid. I think the airplane ones where, there's a hard suction down, that's probably better than almost any other type of flush, because it's so strong sometimes I can feel it even from where I'm standing. But close the lid anyway. Some of even are designed so that you can't flush unless you close the lid. I think that's a good design. And yeah, definitely do flush. Close the lid and then flush, and then wash your hands. Use a paper towel to touch things on your way out and get out of there in and out as quickly as possible.
And probably wear the mask on the airplane all the time.
Yes, masks on the airplane all the time.
In that same vein, I don't know if this is a completely fair question, but let's see if you want to answer it. Joshua asked, Professor Marr, would you personally fly on an airplane today if the trip was a long planned vacation, but not a necessary trip, or either essential or not essential? It's not, your situation is your situation, but why don't you tell us what you think about that question?
So I think I would do it if the plane were maybe half full or so. I would, I have some tickets now. I'm kind of watching, and the day before, I'm going to look at the seating chart and see how full it looks. And if it's too full for comfort, I'm making sure my plans are flexible so that I will take a different flight. I would feel more comfortable. I know that airlines are supposedly requiring people to wear masks, but I've heard they're not enforcing it. I would feel more comfortable if they were enforcing it, and I would, if I knew they were enforcing it, and maybe making sure planes weren't more than, let's say, 2/3 full, then I would feel comfortable making reservations for future trips. At this point, I'm not. It'd have to be something very, very important
for you to fly.
Yeah.
What about parents who are what about me? I'm sending my daughter back to college, and she has to go on an airplane. There's really not another way to get her back there. I feel like she's young, her risk is low, I can minimize her risk, but I have to kind of weigh the risk of her being on a plane versus not going to college. I mean, the stakes are high, right? So
yeah, no, I think you're right. If she's healthy, the risks are not zero, but I think if she's wearing a mask and and the plane isn't packed full, right. To me, it's acceptable, but that's going to depend on people's personal situations and risk tolerance.
And I think it would be different if I knew she was going to be around somebody who was vulnerable. She's going to go and probably have some level of quarantine. And so I guess that's why these questions are hard, because it really depends on who's around you, who you're coming into contact with, what your personal health is. A listener asked, what is the risk of riding in an Uber, both from the driver and from other passengers who may have just been in the car? How long can it stay on surfaces? So why don't you talk about getting in an Uber or a taxi?
That's a good question. In terms of the surfaces, the virus can survive for several hours on some of the hard surfaces, probably. So certainly while you're in there, don't touch your face. And as soon as you get out, I would wipe down my hands. In terms of the air, I feel comfortable going in there if the windows are open. There's some older studies showing that the ventilation in a car, if the windows are 3 inches open, at least is very good. And so I think but I still think, driver and riders should be wearing a mask.
So if the windows are open about 3 inches on either side, then both driver and passenger are probably going to be okay based on the research?
I think the risk of transmission in that case is very low. And then I would add on top of that the mask. We're talking about kind of multiple interventions here, so that I'm an engineer. We like to have kind of backup plans.
Right. Now, we've also talked about people, there's a lot of people who are very dependent on caregivers, on domestic workers, on housekeepers coming in, disabled people, older people, and also just people with families who love their housekeeper and want, to keep them employed. What would you say to those people about how to protect the worker and how to protect their families? What's the safest for both?
So if there's someone, from outside coming into your house, I think you can, before they come in, open up all the doors and windows for an hour or two beforehand. When they're there, you should not be there. After they leave, again, kind of open up the doors and windows, or just leave them open the whole time before you come back in. They're cleaning. Cleaning is good because that can remove any viruses that might be lingering on surfaces. So I think it can be done in ways to minimize the risk, I guess.
I would also want to add that maybe you should reassure the person who's working for you that if they do feel ill, that they're not going to lose their income, that you'll still pay them. Incentivize everybody. If I feel sick, I'm going to keep you safe. If you feel sick, keep me safe, and I'm going to make sure that financially you're okay. There needs to be that trust, right, with the people coming in and out of your home, that you're going to do the right thing by them.
Right, absolutely.
Another question related, Robert asked, how often should we be cleaning surfaces in our own home? Should we still be thinking about, I know the risk of surface transmission isn't super high, but what about high touch surfaces in our own houses?
If you haven't had any outside visitors to your house and it's just you and your household mates, cleaning's always good, but certainly if someone from outside comes in, I would go through and clean thoroughly, especially those high touch surfaces. In public spaces, I think that's important. Cleaning, hygiene is one of the things that has been shown to be effective at reducing transmission of the flu and some other diseases. So I imagine that applies in this case too, because of these droplets that are in the air. They eventually have to go somewhere, and they'll land on a surface eventually. And they can build up there if you're not cleaning off the surfaces.
Now, a lot of this conversation is focused on precautions and risk, and it is, it's a really uncertain, scary time. But I also think that we have to sort of look forward at what life is going to be like on the other side of this, and what gives you hope. I mean, when you look at the future, we're not going to have a vaccine for a while, but how do you view the future, and what gives you hope, and what makes you feel positive about what's happening now?
I think the scientific community and medical communities have really come together and are working furiously on all these questions. So it's been great to see that kind of collaboration. If I look back 3 months ago, we've learned a lot so far. We've come a long way. And so I think in another 3 months, we'll know even more about ways to kind of minimize our risks of transmission and keep ourselves healthy.
And I want to thank you because you know, the way science journalism works is that we are only as good as the, you know, the scientists who speak to us and who are willing to share their knowledge. And I know you are inundated with press requests, but it's just been knowing that there's somebody out there. You know, we talked the other day about a study that initially looked exciting, but then maybe the analysis wasn't great. And so, you know, with conversations with you and several other scientists, you know, we realized that maybe wasn't the right thing to write about at that point. It wasn't helpful. So I just want to thank you for informing so much journalism, and to the listeners, you know, in PR, the LA Times, the Boston Globe, the Washington Post, the New York Times, CNN, everybody, the Atlantic, everybody's talking to you. So I really wanted our readers to get to know you because you are such an important voice in this, and thank you for all the time. And I've shared enough emails with you quite at late hours of the night that I know that this is a very time-consuming thing for you. So thank you for that.
No, it's exciting that, I guess it's exciting that my research really matters to a lot of people. That's kind of been one of my goals all along. I'm sorry that it's had to come to this. I thought it would be the flu and wouldn't be this bad, but here we are. Please keep the questions coming because they've triggered, you know, really good new project ideas and ways of thinking about it for my colleagues and me.
That's great. So if you want to keep in touch with Dr. Marr, I advise you to follow her on Twitter. At Linsey Marr, and Linsey is spelled Linsey. So follow her on Twitter. It's a bit science-y, but you'll learn a lot. I certainly have. I actually really enjoy your Twitter feed. I always get a really fast glimpse of what's going on in the world of aerosol science. So thank you for joining us today. This event is a weekly series that takes place Mondays at 1 p.m. Eastern. Next week, I'll be joined by the creator of the 7-minute workout. We're going to change it up a little bit. Chris Jordan created the 7-minute workout. We're all trying to figure out new ways to exercise. So he's going to be joining us, doing a workout with us. I think it'll be a lot of fun. To find out more about our full slate of digital events, please visit timesevents.nytimes.com. There's really something for everyone. It's all free, so check it out. Linsey, thank you again for being here. It's just always great to talk to you. I hope maybe we can talk again as things evolve, right?
I imagine we will, Tara.
I think so too. Finally, we want to give a special thank you to all of our subscribers. You make our work possible. We look forward to speaking with all of you again. So stay safe, take care, and thank you, Dr. Marr.